Hi there, this is Nursing Education Videos. Today I will be going over the Hypovolemic Shock NCLEX review on Registerednursern.com. All credit for this information that I am reading goes to Sarah at Registerednursern.com. Again, all credit for this information that I am reading goes to Sarah at Registerednursern.com. Please refer to their websites, or please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. Hypovolemic Shock Nursing NCLEX Review for Students. In this review, you will learn about hypovolemic shock. After reviewing these notes, don't forget to take the quiz that contains hypovolemic shock NCLEX questions and to watch the lecture. Lecture on hypovolemic shock. And so there's a YouTube link there. So what is hypovolemic shock? It occurs when there's low fluid volume in the intravascular system. Hypo means low. Volume, vol means volume. Emic equals blood. So hypovolemic shock is low blood volume shock. The intravascular system is the space that contains the volume of blood in a person's circulatory system. Therefore, if there is a decrease in the volume of blood in a person's circulatory system, what does the heart have to pump? Hardly anything at all. If the amount of blood the heart pumps to the organ/tissue decreases, the cardiac output decreases. This will lead to decreased tissue perfusion, which will alter the function of cells. It will limit their access to oxygen, and signs and symptoms of shock will occur. A person needs to lose about 15% or more of their intravascular volume for hypovolemic shock to occur. The average human blood volume is 5 liters. Exact amount depends on the person's size. So, if a person who has a blood volume of 5 liters and loses 1 liter of blood volume, so 1,000 milliliters, that would be 20% of their blood volume. This person would start showing signs and symptoms of hypovolemic shock. Causes of hypovolemic shock. What can lead to a loss of fluid volume in the intravascular system? Any condition that leads to fluid leaving the body externally, or there is shifting of fluid within the body that leaves the intravascular space. Relative hypovolemic shock. This is an inside fluid shift from the intravascular system. This tends to be more concealed than absolute. Fluids or blood collecting or leaking inside the body from internal bleeding, third spacing of fluid due to severe burns due to increased capillary permeability, fracture of long bones, damage to organs like the pancreas, example, Cullen or Turner's sign. Massive vasodilation from septic shock. Absolute hypovolemic shock. This is an outside fluid shift from the intravascular system that leaves the body. This tends to be more noticeable compared to relative. So these are massive bleeding from injury or surgery, excessive fluid loss from the oral route, so vomiting, GI route, diarrhea, so gastrointestinal, GU, which is the urine, so it's the genitourinary, and then integumentary, which is sweating. Many times this is caused by a disease process such as diabetes or endocrine disorders or illnesses. Pathophysiology of hypovolemic shock. What is happening in hypovolemic shock? There's a major depletion of volume in the intravascular system, relative or absolute causes. This decreases the amount of venous return to the heart. This is the amount of blood draining back to the heart. So this decreases preload, the amount the ventricles stretch once they are filled with blood. They won't be stretching very much because there isn't much fluid to fill them. This decreases stroke volume, the amount of blood pumped by the left ventricle with each beat. And then this decreases cardiac output. This is the amount of blood the heart pumps per minute, 4 to 8 liters per minute. Cardiac output equals heart rate times stroke volume. If cardiac output falls too low, the amount of blood that should be going to the organs/tissue cells per minute will drastically fall. And guess what important substance is in the blood that these cells of the organs and tissues rely on to survive? Oxygen. But since the amount of blood that reaches them is low, the cells won't receive enough oxygen to function, and hypoxic injury to the cell can occur. The body will attempt to compensate by activating the sympathetic nervous system, which will trigger the body's built-in survival system. Now, based on the percentage of fluid volume that is lost, will determine the signs and symptoms the patient may present with and what stage the patient is likely in. Hypovolemic shock can be divided into 4 stages or classes, and these are the stages of shock we just reviewed in this series. But these stages are based on the percentage of fluid volume loss. Remember the numbers: 15, 15 to 30, 30 to 40, 40%, and what is happening to the blood pressure, heart rate, urinary output, mental status, and the skin. Class 1. Less than 15% of volume loss, up to 750 milliliters in an adult. The body can maintain cardiac output with this volume loss. Patient is mainly asymptomatic with this class. Heart rate within normal limits, less than 100 beats per minute. Blood pressure, respiratory rate within normal limits. Skin pink, warm, and capillary refill normal, less than 2 seconds. Normal urinary output, which is greater than 30 milliliters per hour. Mental status normal, may be a little anxious. Class 2, 15 to 30% of volume loss, between 750 to 1,500 milliliters in an adult. Cardiac output is starting to fall due to the volume loss. There is major body system compensation via the sympathetic nervous system, renin-angiotensin system, and the shunting of blood to vital organs. Heart rate will increase, tachycardia, greater than 100 beats per minute, due to the effects of the sympathetic nervous system. Blood pressure decreases, but within normal limits, for now, due to vasoconstriction. Respirations increase, mild, due to low oxygen level in the body. Urinary output will start to lower, 20 to 30 milliliters per hour. Blood flow is shunted, and body will start to keep water from aldosterone and ADH being released due to angiotensin II. So ADH is the antidiuretic hormone, I think. Skin is cool, clammy, increased capillary refill greater than 2 seconds, blood flow diverted to vital organs, diminished peripheral pulses. Mental status would be mild anxiety. Class 2, 30 to 40% of volume loss, 1,500 to 2,000 milliliters in an adult. The body can't compensate anymore, it's exhausted. Therefore, cardiac output falls so low that tissue perfusion is altered, which causes the cells that make up the organs to malfunction: heart, liver, lungs, kidneys, brain, etc. Heart rate increased, significant tachycardia greater than 120 beats per minute, respiratory increased, progressing to respiratory failure, hypotension, oliguria less than 30 milliliters per hour of urine output, renal failure, high BUN, which is blood urea nitrogen levels, and creatinine, so high blood urea nitrogen levels and creatinine, poor peripheral pulses, skin is very cool, mottled, and capillary refill will be greater than 2 seconds. Mental status, very anxious and confused. Acidosis, low oxygen and low perfusion to the brain. Class 4. Greater than 40% of volume loss. More than 2,000 milliliters in an adult. Death is very near. Needs very dynamic treatment. The body is shutting down. The fluid loss is severe. Significant tachycardia, greater than 140 beats per minute. Increased respiratory status, leads to respiratory failure. Severe hypotension, anuria, no urine production. Mental status is lifeless and coma. So it says here increased respiratory. I assume it's increased respiratory status. That could lead to respiratory failure. Source is the class/stage volume loss percentage and amount of volume loss modified from American College of Surgeons guidelines. Signs and symptoms of hypovolemic shock. Remember, it depends on the percentage of volume loss, but in a nutshell, tachycardia, hypotension, cool/clammy skin, weak peripheral pulses, anxiety, decreased urinary output, and central venous pressure low. PAWP/PCWP low. PAWP, according to Wikipedia, is pulmonary arterial wedge pressure, and PCWP is pulmonary capillary wedge pressure. So nursing interventions for hypovolemic shock. Treatment goals: fluid resuscitation, correct underlying cause that is leading to the fluid loss. Example, hemorrhaging would be surgery, get the patient ready for surgery. So the treatment goals is the fluid resuscitation and to correct the underlying cause that is leading to the fluid loss, which is causing the hypovolemic shock. Next, nursing interventions. Monitor oxygenation and perfusion status of patient. Place patient on oxygen. May need intubation and mechanical ventilation. What is the patient's hemodynamic status? Blood pressure, heart rate, rhythm, tissue perfusion to organs, mental status, urinary output. Brackets will need catheter insertion to closely monitor urinary output. Urinary output, so UOP, needs to be greater than 30 milliliters per hour. If bleeding, hold firm direct pressure on the bleeding site. If showing signs and symptoms of hypovolemic shock, place in modified Trendelenburg position, feet at 45 degrees and head flat. That position increases venous return to the heart and cardiac output. Obtain IV access. At least 2 IV sites that are large, 18 gauge or bigger in a large vein like anticubital, needed for rapid fluid delivery and other medications. Many patients with severe hypovolemic shock, especially ones who are not responding to fluid treatment, will have a central line and hemodynamic monitoring to monitor cardiac output and fluid replacement. Collect labs. Hemoglobin, HGB, hematocrit, so HCT, blood levels, lactate level, status of cells metabolism, blood gases, acidosis, electrolytes, BUN, so blood, urea, nitrogen, and creatinine. Severe hypovolemic shock, where the central venous pressure is low and the pulmonary arterial wedge pressure and pulmonary capillary wedge pressure is low. I think I'll need some time to get. It'll take some time to get used to PAWP and PCWP. Fluids for hypovolemic shock. Crystalloids and colloid solution are 2 types of volume expanders used in hypovolemic shock. It varies depending on the patient's status and volume loss. Crystalloids. Normal saline or lactated ringers. Isotonic fluids that will add more fluid to the intravascular system, increasing preload, stroke volume, and cardiac output. Most commonly started out on a crystalloid solution. Watch for fluid volume overload. If in fluid overload, hemodynamic monitoring may show elevated central venous pressure or pulmonary capillary wedge pressure / pulmonary arterial wedge pressure. Auscultate for fluid in the lungs, such as crackles, edema, jugular venous distension. Remember the 3-to-1 rule for crystalloid solutions. For every 1 milliliters of approximate blood loss, 3 milliliters of crystalloid solution is given. Crystalloid or asterisk. Crystalloid solutions are able to diffuse through capillary wall. So there is less fluid that remains in the intravascular space compared to colloid solutions. Colloids. Albumin, hetastarch, made up of large molecules, example, proteins, that can't diffuse through the capillary wall, so more fluid stays in the intravascular space for longer. These are more expensive. Patient can have an anaphylactic reaction. Monitor for fluid overload. If given large amounts of fluid, needs to warm them. Why? If not warmed, it can lead to hypothermia, and this will alter clotting enzymes. Keep the patient warm but not to the point of sweating. Blood and blood products, packed red blood cells, platelets, or fresh frozen plasma, FFP. So PRBCs are the packed red blood cells, helps replace fluid and provides the patient with hemoglobin, which will carry oxygen to deprived cells. Crystalloids and colloids can't do this. These types of fluid may be used when the patient is not responding to crystalloid fluid exchange or crystalloid fluid challenge, experiencing severe bleeding / severe hypovolemic shock, etc. Platelets for uncontrolled bleeding to help with thrombocytopenia. Fresh frozen plasma for when the patient needs clotting factors. ******. Monitor for transfusion reaction with these products. So the references is the American College of Surgeons Division of Education, ACS/ASE, Shock Medical Student Core Curriculum, ebook page 4, retrieved from www.facs/media/files/education/core%20 curriculum/shock.ashx. Hypovolemic shock. Medline Plus Medical Encyclopedia, retrieved from https://medlineplus.gov/ENCY/article/0000167.htm. So 000167.htm. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information and check out their YouTube channel. I hope everyone has a great day, and thank you.